So I think that AI in myeloma is still nascent and still evolving. I think artificial intelligence has had a more profound impact in other diseases and in other cancers, particularly lung cancer and breast cancer, which is where a lot of my research has been up to this point. But when I was asked to come and present the keynote lecture on AI in multiple myeloma, I was both intrigued, flattered, but at the same time, I was a little hesitant and nervous because we hadn't done a lot of work in multiple myeloma with applications of AI. But as I started to do some research, I realized that there's not a lot that's going on. But I think that represents a tremendous opportunity. A lot of the work that our group has done has been with analysis of digital pathology images to predict outcome across multiple different cancers, both solid cancers as well as non-solid cancers. I showed some data today on acute myeloid leukemia. And I think that's a tremendous opportunity. One of the things that I've already picked up at the symposium, at the meeting, is the fact that we need better ways of characterizing risk, particularly high-risk myeloma. And so I think there are tremendous opportunities there with artificial intelligence, with routine data, to be able to come up with more granular, more quantitative ways of characterizing risk. One of the pieces of data that I did present in my keynote talk this morning was on the use of AI with routine fundus images, so images of the eye, where the data suggests that we can predict which patients are likely to go on to develop multiple myeloma up to 10 years. And so this is very early data, so we're still wrapping our heads around what it means and trying to delve more deeply into the data. But I think that that's the kind of application area where AI could really start to have an impact in multiple myeloma. Right, so I think that there's a huge opportunity with routine data. I think that's been the main mantra of our group in particular, is how do you leverage routine data to try to go above and beyond the status quo? How can we get to better diagnoses? How can we get to more granular quantitative risk stratification, prediction of progression of multiple myeloma? And then further on, thinking about response to therapy. I think that's another huge frontier for us to be looking at. I showed data as part of my keynote lecture this morning on how we're using AI in the context of lung cancer, for instance, to predict response to immunotherapy. And I know that with CAR-T therapy in the context of multiple myeloma, there's a big opportunity for us to develop predictors of response, being able to identify who is going to respond to the therapy and who is not going to respond to therapy. So I think that there are multiple different opportunities, like I said, from the diagnostic realm to the prognostic realm, but really on the predictive realm as well. And really, as we think about precision medicine in the context of multiple myeloma, I think AI will play a significant role across that continuum of unmet needs, diagnostic, prognostic, and predictive. And I'm really looking forward to the next 3 days to continue to learn on the unmet needs and how AI could have an impact in multiple myeloma. I think the other big piece that I would say is for us to, we're here in the beautiful city of Rio, we're in Brazil, which perhaps doesn't have quite the resources that countries out in Western Europe might have, or certainly in North America. And one of the things that our group has really focused on is how can we leverage technologies like AI to try to level the playing field a little bit. How can we think about opportunities for these technologies in the context of low middle income countries? And then beyond that, how do we think about the use of these approaches to address disparities, health disparities? We know that a lot of these tools, when they're trained on data from one population, may not really translate or generalize to other populations. And so I think as we think about opportunities with AI, we have to be really cognizant of the fact that we have to be intentional about how we're developing these tools, how we're validating these tools, to ensure two things. One, that these tools truly are equitable and unbiased, that they work across a plurality of populations. And B, we got to make sure that as we develop these tools, that we're developing them in a way that allows for scaling and deployment, particularly in low middle income countries, countries with lower resources. And that means we need to be thinking about how to leverage routinely acquired data radiology scans, pathology images, routine data that's part of the clinical workup for these patients. And I think really by doing that, not only are we starting to exploit the use of technologies, powerful technologies like AI, but that gives us an opportunity to think about dissemination and deployment at a global scale, which I think is really critical.